Alright, so I'm gonna knock my door. Knock, knock. Hey there, Miss Ford. My name's Kylie. I'll be your nurse today, okay? I'm just gonna wash my hands real fast, okay? So as I'm washing my hands, I'm gonna make sure that I look around my room, make sure everything's good. Cereals are up. She had her call light. She looks good. Make sure there's no hazards on the floor. So I'm gonna wash my hands real fast. I am going to notice that she does have a NG or OGN. She's vented, and she does have a EVD on her left side. So let's wash my hands. Alright, hi there, Miss Ford. Can you open up your eyes for me? No. So I have to remember, since she is intubated, she can't talk to me, so it is kind of difficult for her to tell me her name, date, and birth. So I'm going to look at her band, and I'm going to make sure I double check it with my computer, make sure I do have the right patient, it is the right information on her band and the computer. So her name and date and birth are correct. Do have the right patient. Since she did come in here for neuro from a fall, I want to make sure that as I do my head to toe assessment, I am also going to do a little bit of a neural assessment. So like I said, she does have a EVD, so I'm going to check her head and look at that placement. I know it knows to be on the left side, and it was at 15, and that's nice and clean and dressing. I'm going to look at her eyes. Miss Ford, can you open up your eyes for me? Okay, so she's not opening up her eyes. I'm just going to lift them up gently, and I'm going to take a look at her pupils. Go to the light. And they are both reacting to the light. They are about 4 millimeters even, like I said, reacting to the light. Since she does have a OG, I'm going in ventilator in. I'm going to look at her mouth, make sure that her mucus membranes are good, nice and pink. I want to make sure she doesn't have any sores around her mouth from the tubes. So that looks good. I'm going to take a look at her face. I'm going to turn her head and look for JVDs. No JVDs, which is good. Her face looks nice and symmetrical too. I'm going to feel her skin. Skin's all nice and warm, pink, no edema. Okay. I'm going to check her capillary refills. Miss Ford, can you squeeze for me? Go ahead and squeeze. So I got a little bit of a squeeze. Can you wiggle your fingers? Move your fingers. Okay, got a little bit of wiggling. Once again, she's intubated, so I can't ask her if she has any numbing or tingling or any pain. So I'm just going to kind of look at her face and make sure she's not grimacing while she's moving. Make sure she's not in pain. I'm going to go ahead and do my vitals real fast. So I'm going to grab her temperature. So go underneath her arm. So like I said, she's intubated. So we're going to go underneath her arm. I'm going to hold that. I'm going to check, taking her temperature. I'm going to go ahead and put her oxygen, check her O2. So I was going to go check her O2. Okay, got her temperature. Her temperature is 98.9. I'm going to feel her pulse real fast. Both arms. Pulse is present bilaterally. Nice and strong in both arms. I'm going to go ahead and count for a minute for her pulse. Okay, as I count for a minute, I got 84 for her pulse. And I'm going to count her respirations too. Her respirations were 16. I'm going to go ahead and grab her blood pressure at this time. So as I put on her arm, go ahead, like I said, listen to her blood pressure. Take that, and once I get done with her blood pressure, I got 124/68. Alright. Miss Ford, I'm going to go ahead and listen to your lungs, okay? So I'm going to go ahead and listen to her lungs. So right now her lungs are nice and clear, bilaterally. Since I'm not going to be able to roll her by myself, I'm going to make sure I get her side and try to get her as much as her back as I can. And then I would just wait until I had someone else in the room to help me roll her so I can listen to her back then. I'm going to go ahead at this time also listen to her apical pulse. Her apical pulse is nice and strong and present. 84 for her apical pulse too. As I have her shirt up, I'm going to listen to her belly. Start at the right lower quadrant and go up. And go to the left side and go down. So she does have vowel sounds in all 4 quadrants. I'm going to head and rub her belly. I'm going to look at her face, make sure she's not grimacing as I'm touching, make sure it's not tender. Okay, she's not making any face. Where I have her shirt up, I'm going to look and make sure she doesn't have any dressings or any bruising or anything from her fall on her torso. So that looks good. I'm going to go ahead and go down to her legs, feel her legs. Her legs are nice, warm, and dry. Skin is pink also. No edema. I'm going to feel for her pedal pulses. So her pulses are good. Miss Ford, can you push down? Okay, and try to pull up. Okay, I'm not getting really much from her. Can you wiggle your toes for me? Move your feet. So a little bit of a wiggle on her toes. That's it from her. Alright, so I did her head and toe assessment. I checked all her tubes, her EVD tube, her OG, and her ventilator tube. They are all in the correct place and at the correct number that they were at from what I got from the previous nurse. I'm going to make sure that I document my assessment, correct format, date, and time. As I go and look at my computer, I did find that the doctor did place an order in for a Foley. So I'm going to go and get my Foley catheter kit. Before I go, I want to make sure that my patient is nice and safe. Side rails are up, and I'm going to go grab my Foley catheter. Pass. Alright, so knock on the door again. I'm going to make sure I close my curtain since I am going to be placing a Foley catheter. Let her know that I'm here. Miss Ford, it's Kylie again. I'm going to be putting a Foley catheter, okay? The doctor ordered a catheter for you to help drain your urine, okay? So I'm going to wash my hands real fast. Wash my hands. I let her know what I was doing, what it was for. So, like I said, I have my kit right here. Lift her up a little. And take this off so I don't have to worry about that falling down, contaminating her. I'm going to make sure that I do keep my sterile technique. So I'm going to put my stuff on a bedside table. I'm going to make sure I open it away from me. So go away from me. Okay. And then take this out. And I'm going to take the pad that's in here that's sterile, and I'm going to put this under her. Make sure I keep, like I said, sterile technique. A little harder for baby dolls, so make sure I put this underneath her legs. And I would have someone in the room to help me too, since she is not really following commands. So just for a second hand, I would make sure I would have help. And then I'm going to bring my tray a little bit closer to her, but on the white pad, make sure she doesn't touch it. No, keep my sterile field. And put on my sterile gloves. I have my sterile gloves on, had her gown up, got her ready, got the pad underneath of her. I have my tray as close as I can with her. I'm going to take my iodine. I'm going to go over the cotton balls with this. So I pour this over my cotton balls. I'm going to take my lubricant, spray it in here so that way it's all ready for me. I'm going to take my sterile water and I'm going to hook this up to my balloon. So when I'm ready for it, it's already hooked up and I don't have to worry about that. I'm just going to make sure that my balloon is nice and good, that there's no holes in my balloon. So my balloon is holding the fluid, there's no holes in it. I'll make sure I take the fluid back out. Okay, keep that in there. Alright, I'm going to grab my cotton balls. I have that iodine on it. I'm going to make sure that I keep one hand clean and one hand dirty. So when I spread her menorahs, I'm not going to move my left hand then. So I'm going to do the outside one swipe. I'm going to toss this in my trash. Grab another one, do the inner labia, trash. Do the other outside, the right outside, trash. Do the end of the right side, trash. And then I want to make sure I go down the medius. So I'm going to go down on that, clean down the middle. So make sure all this is out of the way and make sure I throw it in the trash. Like I said, make sure I keep my sterile field. Alright, so then I'll be ready. Keeping it. So I'll have with my dirty hand, my left hand, I still have her open. With my clean hand, I'm going to grab the catheter. I'm going to make sure that I insert it into the urethra. If I, for some reason, went into the vagina, then I would restart. I would not use the same one, or if I were to drop this, I would get a new one. So I would insert this, and then with the females, once you get urine, you want to go another 2 to 3 inches. I'm going to insert a little bit more. And I have urine flowing into my tube. And then I'm going to insert my water into my balloon to keep it in place. And now that I have the water in there, I can let go with my dirty hand. I'm going to twist that off. And I'm just going to give a little bit of a pull just to put it in place. So that's in place. Like I said, urine in my Foley. And then I would make sure that I secured the Foley, the tubing, to her leg. We do her inner thigh. Make sure that's nice secure. Make sure it's not too tight because you don't want to cause any breakdown around the vagina. So after I did the Foley, I make sure I clean up my mess. I would document in the correct format, the time and date. I would document how the patient handled it. the size of the French that I use, how much urine came out, and the description of the urine. So I'm going to clean up, and I'm going to put everything away and document real fast. I came back in the room and I saw that the doctor had ordered some normal saline to prescribe to give her. So I'm gonna knock on my door again. Hey there, Miss Ford, it's Kylie again. I'm just gonna give you some extra fluid, okay? It's gonna go in your IV. So I want to wash my hands. I'm going to check my MR again to make sure I have the correct patient. When I look at her band, make sure I do have the right patient, correct name, correct date of birth. Wash my hands. I'm gonna go grab my normal saline, and I'm gonna make sure I have an IV pump too. Okay, so I have my normal saline right here. I have our IV tubing already. I'm going to make sure that I also have a normal saline syringe, and I'm going to make sure I do have a cotton swab. So before I get her IV set up, I do want to check and make sure that her IV is working. So I'm going to take a look at her IV. It's nice and dry. There's no redness to it. Doesn't appear to be swollen or tender when I push around it. I'm going to make sure, like I said, wash my hands. I'm going to put on, grab a saline, a alcohol swab. I'm going to make sure I clean my tip very well. Clean that. I'm going to make sure I unlock it. Okay, it's nice and clean. I'm going to grab my normal saline flush. That's that. And then I'm going to flush it. As I'm flushing, I'm going to look at her site. I want to make sure that it doesn't look like it's infiltrated. Make sure it doesn't get red. It's not leaking. It's nice and dry still. So her IV is working. I didn't have any trouble flushing it. Let go. I'm going to clip this again. So, like I said, the doctor had put an order for normal saline at 75 mLs per hour. So I got my bag. I'm going to hang it up on my IV pole. I'm going to make sure that once I put in my IV pole, I'm going to set it up for 75 mLs per hour. So I make sure I program that in correctly. Once I have that program, before I program it, I want to make sure that I do flush the tubing of the normal saline. So make sure there is some water in my chamber. And then I'm going to release the clamp and make sure that the normal saline does come out at the end. So I do want to make sure it's nice and primed. Put my normal saline into the chamber of the IV pump, program it. So I'll program, it is primed and ready to go. So got her IV, I've already checked this, it's working. I'm going to clean it off again. So I'm going to clean it off the hub. I'm going to put this in. Okay, so that's ready. IV's hanging up, program, and I'm going to undo the clamp and hit start on my IV. So her IV is going to be running at 75 mLs per hour. All right. And then throughout the day, as I was checking on her for a couple hours, I had noticed that her urine output had been high. Let's see. For the first hour it was 120, and then she went to 180, 240, and then 440. So her urine looked very clear. I notified the doctor, let them know what her output has been. It's been increasing over the last couple of hours. So he had ordered desmopressin to help decrease the urine. So when I would give that to her, give it through IV push, I would let her know what it was for, why I was giving it, and I would push that into her IV with the normal saline, make sure that was compatible. Throughout her day, we noticed that her blood pressure was dropping, heart rate was going up, like I said, urine was increasing. Did some lab work. Her sodium was high, it was 155. Her serum osmo was 310, and then her urine SG was 1.005. So then the doctor had ordered to change her IV fluid, so I would make sure that I stopped her normal saline, discontinue this, and then he wanted D5W at 125 mLs per hour. So to make sure that I would grab the right bag, set it up in the IV pump. Harper, stop. IV pump at 125, get that going. He also had ordered free water flush through her OG tube, so I make sure that I would do that. That was 200 mLs every 4 hours. So before I would start her tube feed or the normal flush, I would make sure that her OG was in the correct place. Like I said earlier, it was at 45. It's still at 45 at her lip. I would still you can check the placement multiple ways. You can listen for the air, do a little air bolus, or do a pH balance. I would check her pH, make sure that it was in the correct format before I started to give her the free water flush through her OG. Throughout her day, okay, and since we are doing that, the flush, and we gave her the medication and change her IV fluid, I'm going to make sure that I do check her sodium regularly. I'm going to make sure it doesn't drop too fast or too low, and I want to check her serum osmo too. So I want to make sure throughout the day I'm documenting in the correct format, the time and date, and what I'm doing from her head to toe assessment to all the orders that the doctors have put in. And then 2 days later, they said that they found that her pupils are now fixated on 8 milliliters, or at 8 mm, and that her GCS is between a 6 and a 4. So I definitely, with the fall, and she's already has the hematoma on her left side, that's an indication too, especially since her ICP went from 12 to 18, so that's showing me that she is having intracranial pressure. It is more swelling too, so I want to watch the sodium, because sodium also makes the brain swell. So I do want to pay attention to her sodium level. I want to let the doctors know of the increase as far as her intracranial pressure. I want to let them know that her GSC is between a 4 and 5, so she's not really responding to me. She's not following commands. We definitely want to keep an eye on that. Okay, so at the end of my shift, I'm going to make sure one more time, do a quick Q-sit on my patient, make sure that she's good. My side rails are up, nothing's on the floor, no hazards or anything. Make sure she's in a good position, nice and comfortable. During my assessments, I also want to pay attention to her posture, make sure that she has no signs as far as retracting or anything. So I'm going to wash my hands and go give reports real fast.